Hi, hello friends, how are you all? And today we are taking up an important topic. Obviously, it's not a very lengthy one. In a very short time, I like to tell you the basics of this particular thing, and I hope you will like it. Okay, so let's start up. And in this, firstly, I like to give you some idea regarding the immunity definition and what are the various types of immunity, and then we'll discuss what is primary immune response and what is secondary immune response. Okay. So, guys, first of all, what is immunity? Immunity is resistance offered by the host against the offenders. Okay, host means us, offenders means which offenders? Offenders means those microorganisms, those mutagens, okay, or some chemicals which behave like a mutagen or behaves immunogenic to us. So, resistance against all of them, that is what is termed as immunity. And to make it more philosophical, what you have, the resistance offered by the host against the offenders, even your negative thoughts also. That is what is the true immunity. Is it fine? So, this you should know first of all. And other than that, this particular thing, that what is innate immunity and what is acquired immunity. Okay. So one by one, we'll discuss of that thing. What is innate and what is acquired? So, guys, first of all, what is innate immunity? The resistance to the infection from the birth by the genetic and constitutional makeup. Okay, that is what is termed as innate immunity. Means the gift which you get from your mother and father, that is your parents, that particular thing makes your innate immunity stuff. So basically, this you have right from your birth, and this is because of your genetic and constitutional makeup. Okay, to simplify the things for you, you remember this way that these three things, that is SIR, governs of your innate immunity. What is SIR? That animal which we are talking about belongs to which species? Okay, which particular individual parents are there, okay, and to which race that particular individual belongs to. So basically, these three things are there. Which three things? The species, individual, and race. These, they constitute our innate immunity. In total, if this is a question in your exam, this have come also in NEET PG this time. So you should have that idea that species, individual, and race. These three are there on which the innate immunity depends upon. Okay, what are the components of innate immunity? The components of innate immunity is what? Right from your skin and mucosal barriers, even your fever, even your inflammation of any sort in which CRP and all is raised. CRP is what? C reactive protein. Your normal resident flora means those particular bacteria which are there without any meaning, but actually they are not without any meaning. They help you to combat the pathogenic organism. Serum amyloid protein, which you call SAP, acute phase proteins, which I just talked about, like CRP, mannose binding proteins, these are there. And there is an alternate complement pathway, which comes up in what? Innate immunity component. Along with that, what else you can add to this particular list is NK cells. So this particular thing comes as a MCQ, that NK cells are part of what? Innate immunity or acquired immunity. So they are part of what, guys? They are a part of innate immunity and natural killer cells, which are CD16 and CD56 positive. Okay. So these are the components of the what? Innate immunity. Regarding the things like this particular innate immunity, it happens to be in minutes because this is already there. Okay, natural one. Diversity is limited of this. Diversity is not limit like very much because it have a specific action for all the microorganisms the same. Okay, so diversity is limited. It is non-specific, not against a particular organism, and there is no memory for the future. Okay, so innate immunity is crude, like okay, which is like those particular fellows which are crude means they will do the things in their own way. Okay, they will not change as per the condition. So that is what is the story of the innate immunity. It will be a crude one. There is no memory, non-specific, diversity limited. Only good thing is it will help us immediately. So that is what is the logic of innate immunity. Is it fine? Now coming to the acquired immunity. Acquired immunity is what, guys? The things which you have acquired in your life. Okay, the things which you have acquired in your life through the struggles. Like you have obtained your MBBS degree, now you are trying, later on will try for the MD also. So these all things which you have acquired up, that sort of thing is termed as what? Acquired immunity. Okay. So acquired immunity is resistance to the infection acquired during the lifetime. Your experiences, your downfalls, your like standing up from those downfalls, that all marks your what? Acquired immunity. Okay. To be more philosophy than I'm telling up. So this particular immunity you acquire through the struggles of your life. Okay. So basically, I'm telling you in that way. And actually, this particular acquired immunity is of these two types. In fact, four types are there: natural active, natural passive, artificial active, artificial passive. Okay. So I will discuss what is this natural active and all. But what you need to know properly that we have said these are all components of innate immunity. So what is there in the acquired immunity part or this adaptive immunity part? So in this, guys, four things they come. Okay. B cell, T cell, antigen presenting cell, and this one is controversial. Some says it is not, but still you can write up classical complement pathway. Okay. Classical complement pathway. These four things are part of acquired or adaptive immunity. Rest of all other things are part of what? Rest of all other things are part of innate immunity. So like this also you can remember of. If at all a short note comes in the exam regarding this, you can manage that with this. Fine. Along with this, in the latest edition of the textbook which you read, in fact you read up in the profs, this also is being given up like cytokines. And which cytokines? Interleukin 2, 4, and 5. These particular ones, they also comes in the part of acquired or adaptive immunity. Interleukin 2, 4, and 5. Is it fine? Now coming to this, that what are the different forms of adaptive or acquired immunity? Natural active. Natural active means the infection happened naturally and the body have worked against that. So natural active is what? Any sort of infection. And if we take an example of COVID, like suppose, okay, so somebody suffered from COVID naturally and acquires it and develop what? Antibodies against that. That is termed as natural active. Natural passive is what? That is natural way, but you have not done anything. That's a gift from somebody. And gift can be given only by, in the nature, by mother. A true gift actually. So natural passive is mother to child. Okay. The passive transfer of what? Immunoglobulins. Okay. So that is through the placenta. These immunoglobulins, they are being transferred up. And that is what is a typical example of what? Typical example of natural passive. Okay. Artificial active. Artificial active is what? Artificial active is vaccine. Okay, artificial active is what? Vaccine. Suppose somebody had taken COVID vaccine, suppose not suffered from the natural infection, had this particular COVID vaccine, so artificially had, and against that the antibodies are produced. So that is termed as artificial active. Artificial passive is what? Artificial passive is ready-made immunoglobulins. Okay, ready-made immunoglobulins. There are certain diseases in which you do not have the time only to handle the things. Okay, because the things are so fast. Okay, like in the rabies. In the rabies, you don't have the time. Because if you like suppose in a category 3 class 3 bite, the bite is at the face, how much time it will take to reach the brain? So 3 mm per hour, the speed of this. So what you want to do? You want to halt up that particular progress of the virus here itself. And that you do up how? With the help of immunoglobulins, ready-made antibodies. Because if you give the vaccine, it will take time. Okay, it will take time and it will take time, a sufficient time of 2 to 3 days. In that particular time period, it will go and it will fix up. And once it's fixed, rabies, is a 100% mortality is present. Okay. So remember that particular component also. So basically, if somebody asks you that which all immunoglobulins you need to remember, in which diseases the immunoglobulins are there, so that is RHTDM. What is RHTDM? That is for the rabies, okay, for the hepatitis B and A, okay, for the tetanus we have ready-made immunoglobulins, okay, for the diphtheria we have immunoglobulins, and M is measles. M is measles, and even guys for the varicella zoster also you have what? Ready-made immunoglobulins available nowadays. Okay, so this is what is the story of what? Adaptive or acquired immunity. And these are the components of it which you need to know. And what is the difference between this and innate immunity? That was happening in minutes. It takes time. Okay, it occurs in days, but it act against a wide range of infections. It is the diversity is not limited of it. It is very specific. Okay, if the COVID virus have come inside, the COVID antibodies will fight, not any other. So it's very specific. Okay, and memory will be there. Means once it is allowed, but second time they develop a memory against that microorganism. Next time if you come, you will be mercilessly killed. So that is what is the story of this particular, that is specific and memory is present. Is it fine? So this is the story of what? Acquired or adaptive immunity. And these are the differences which I've told up between the acquired and the innate immunity. Components we have discussed up, these are the components, and everything is a part of innate immunity except these one, four. Remember like this, you will able to recall up in the exam very fast. Okay, B cell, T cell, antigen presenting cell, and classical complement pathway. Along with that, these interleukins also. Interleukin 2, 4, and 5, they are also components of what? Acquired or adaptive immunity. And these examples you can give up in the question if this is a prof question, and you can put up like this particular chart. If you are able to put up properly, full marks will be given to you in the exam for sure. Okay. So this is the way to handle up the difference between the acquired and innate immunity. So coming to this particular one, that is there are two types of responses, guys. How does they respond to the pathogens and all? So one is primary immune response and one is secondary immune response. Primary immune response is what? Primary immune response means when the first time the organism come into the body. So who will meet it? Antigen presenting cells. Okay, so they will process it and they will bring it to whom? CD4 T cells. Because exogenous antigens of our body, they are cared by whom? They are cared by CD4 T cells. So you need to know that. So primary immune response, because of these processes, is slow, sluggish, and short-lived. If this is a short note in your exam that write about the primary immune response, then what you should write? That it's a slow, sluggish, and short-lived response. And SIR is what? It is a prompt. Okay, it is a prompt. It is a powerful and prolonged response. Okay, it's a triple P, prompt, powerful, and prolonged response. So, guys, I told you when firstly the organism comes into our body, okay, like suppose this is an antigen which have come into our body, who will be there at the entry point? Antigen presenting cells. And antigen presenting cells will be telling us, come, we will like handle you up. And what they do, they really handle it up, they kill it. Okay, they chop it, and this particular antigen, like suppose this is a fragment like this peptide fragment, so they chop this into pieces, small pieces, and one of the piece they put it over their surface. Who? The APCs. You know APCs are what? Antigen presenting cell, macrophages and all. Okay. And this particular thing is termed as what? It is termed as peptide fragment. This particular thing is termed as what, guys? It is termed as peptide fragment. Okay. So this complex of peptide fragment along with antigen presenting cells is to be taken to whom? CD4 T cells. Okay. Is to be taken to whom? CD4 T cells. CD4 T cells are what? They are the central effector cells of the immune system. Means they are the, what do you say? Krishna Bhagwan of the immune system. CD4 T cells. Fine. So every exogenous antigens, even though they are being killed by the APCs, they have to be brought to whom? CD4 T cells. And these CD4 T cells are king. So they have some photographers that is termed as T memory cells. Okay, those particular photographers, what we have the name? We have the name of the T memory cells. And these T memory cells are what? These are the photographers. And if they are the photographers, remember, they will take the photo of this peptide fragment from different angles. And when they take the photo of this from different angles, what will happen? The time will go. And that's why we say that the first process is what? Slow. It is sluggish. And the immune response which develops from this is also short lived. Okay. So what happens? These particular activated T cells, what they do? They will release what? They will release the cytokines. Okay. What they will release? Guys, they will release the cytokines. And the cytokines will do what? They will activate the B cells. They will activate what? They will activate the B cells, and activated B cells, you know, is what? That is plasma cells. And thereby, from this primary immune response, which immunoglobulin will be produced? IgM. Okay. From these plasma cells, the first one will be produced what? IgM. And that's why we say that IgM is predominantly seen in the primary immune response. Is it fine? So this is primary immune response. And why it is slow? Because photography is being done and photography takes time. So that's why you remember like this: slow, sluggish and short-lived is primary immune response, and IgM is produced mostly. Okay. Suppose the same organism tries to enter again. What will happen this time? This time will the action will be prompt, powerful, and very long duration one, prolonged. Okay. Again, in any of the immune responses, IgM will be produced first. But this time what will happen? It will change to IgG very fast. IgM changes to what? IgG very fast. And this particular thing, you know, is termed as what? Isotype switching. Okay, this particular step is termed as what, guys? Isotype switching or class switching. Class is changing from M to G. And this happens due to what? Change in what? Heavy chain or light chain? The answer is heavy chain. In which portion? Constant or variable? In the constant portion of heavy chain. When the change happens, M changes to G, M changes to E, or something else. So this class switching or isotype switching happens because of the change in what, guys? This also is important. This is in the heavy chain. And which portion of heavy chain? Constant portion, guys. Which portion of heavy chain? Constant portion of heavy chain. Remember this particular point. This will come somewhere definitely. Okay. And you must be knowing up a particular disease, or later on you will be knowing up that there is one syndrome also, hyper IgM syndrome, in which IgM is produced but it could not able to switch to the IgG because of the CD40 ligand defect, CD40L defect that is there. Okay, so that we'll discuss later. But still you should know that what is isotype switching, what is class switching. This is isotype switching or class switching, and you can see this is termed as secondary immune response. Okay, and this will be very powerful. It will be immediate, and the IgG which will produced is will be like sustaining up for a very long time, might be lifetime also sometimes. So this particular immune response stuff definitely depicts up this particular aspect, that why we need to have two doses of vaccine. This is the reason why we need to have the two doses of vaccine, because the first dose of vaccine proves it to be what? A primary immune response for us. And the secondary immune response is the second one. Okay. So that's why it is necessary to complete your vaccination schedule. Because if you do not take the secondary vaccine, that secondary dose, the secondary immune response would not be forming. And if it is not forming, your IgG predominance will not be there and prolonged immunity will not be there. So this is the logic, that it's always good to have the second dose. And that's why you have taken up in the COVID the second dose of the Covishield. So that's the reason that IgG will be produced so much that sometimes for the lifetime they cover you in the immunity. Is it fine? So this is the logic of primary immune response and secondary immune response. And if we try to understand this with the help of a particular this graph, So you can very well see that on the first day, suppose these this time on the x-axis the days are there and antibody concentration on the y-axis. So on the first day there is exposure to the antigen A, and what you observe after the exposure to the antigen A, this particular time period, like okay guys, I'm back and explaining of this particular graph to you. Okay, so the exposure to the antigen A is there, and against that you have this particular what? This particular antibodies at this particular concentration of 10 to the power 1, between 10 to the power 1 and 10 to the power 2. Fine. After that, there is a second exposure to the antigen A, see here at this particular point, and see the antibodies to that and the level of that. So that level is very much increased. Whereas when the first exposure antigen B is happening, the antibodies are only this much. So this is what is the logic I'm telling up. The primary immune response is always less and the secondary immune response is always more. Okay. So guys, this is what is the logic which I want to tell up, that the primary immune response is slow, sluggish and short-lived, and the secondary immune response is what? Prompt, powerful and prolonged. Okay. So thank you so much for this particular one, and do tell up in the comment section like how you like this lecture and all, and later on we'll discuss up all other antigen part or antibody parts, immunity parts we'll discuss up in which you face some problems. Okay. So thank you so much for today. Take care.